nakuye program director. Nginvusele nonke bekunene in this beautiful day in Matapa. Ngiyanivusela bekunene. Nibahle kakhulu nonke. Ngicela ukutibika nje kubahlonishwa bo chairman bami bema portfolio ukuthi ngithe ngifaka lo makalabha bo chairman bami sengikhohliwe ukuthi kunepompom la. Sawukhanza uhambe emoyeni ngiyasho ngithi hayi labo makalabha vele ba gender insensitive. We have to make a plan. I see there are a lot of ladies here to accommodate the different styles for ladies in the workplace. May I greet you all this morning. Chairperson of the Ministry of Labour and Social Security Portfolio Committee, Honourable Senator Sylvia Mthethwa, and the Honourable Ludvo Dlamini. We are very privileged to have you this morning, and all honourable members of both houses of Parliament who are present with us today. May I also greet you and welcome you. Principal Secretary in the Ministry of Labour, ILO OSH Specialist Pretoria Office, Employers and Workers Federation representatives, our special panelists who are with us today for this event, representatives of the Mine Workers Associations, members of Tripartite Advisory Technical Committee for Occupational Safety and Health, all government officials who are with us today, and all participants who are following this event live on television, and also participants who are following us on all online platforms. We welcome you this morning, and a very good morning to all of you. Today, the government of the Kingdom of Eswatini joins the entire world in celebrating the World Day for Safety and Health at Work. The main purpose of this celebration is to promote the prevention of occupational accidents and diseases in the world of work. It is an awareness-raising campaign intended to focus international attention on the magnitude of the problem and on how promoting and creating a safety and health environment culture at work can help reduce the number of work-related deaths, diseases, and injuries. According to the International Labour Organization estimates, every year, over 2.3 million women and men die at work from an occupational injury or disease. Over 350,000 deaths are due to fatal accidents, and almost 2 million deaths are due to fatal work-related diseases. In addition, over 313 million workers are involved in non-fatal occupational accidents causing serious injuries and absence from work. The ILO also estimates that 160 million cases of non-fatal work-related diseases occur annually. These estimates imply that every day, approximately 6,400 people die from occupational accidents or diseases, and that 860,000 people are injured on the job. I note that Eswatini is not an exception to these global trends, as fatal accidents at workplaces and non-fatal ones are increasing each reporting period. And this, ladies and gentlemen, has to stop. Small economies like ours are disproportionately affected by the adverse effects of safety and health at the workplace, as it dissipates the already constrained skill base and productivity levels. Addressing issues of occupational safety and health promptly and decisively does not only save lives, but it also has a significant bearing on economic performance in that it decreases insurance premiums and payouts, whilst also improving workers' performance, morale, and productivity, as well as reducing absenteeism. To us in the Kingdom of Eswatini, this year's safety and health at work is a renewal of our commitment to this very important aspect of workspace governance. This is an opportunity for us to reflect on weaknesses and strengths, and a call to all our social partners and stakeholders to dig deeper in our comparative advantages and bring to the table innovative ideas to make the workplace safe, healthy, and exciting. It will be critical that we at government scale up our inspection and workplace accident reporting systems and deepen our research capacity on disease burden and exposure to health hazards at the different workspaces to inform investments in prevention and response systems. I believe that this occasion today will set the tone for such programs to be initiated for review in future World Occupational Safety and Health Day celebrations. I am aware that the ILO has supported the government of Eswatini in the preparation of an occupational safety and health work profile, which is a snapshot of how we stand as a country against OSH global standards. Looking at the profile, I note that there is still a lot that remains to be done, and it is for that reason that today, as part of this celebration, the Ministry is relaunching the Tripartite Advisory Technical Committee on Occupational Safety and Health to, amongst other things, hasten facilitation of bringing Eswatini up to speed with global occupational safety and health standards. I am particularly impressed with the diverse skills of this team, and I have confidence that they will deliver on their mandate. Today, we are joined for the first time in these celebrations by the Eswatini Mine Workers Associations. These are current and ex-mine workers of South African mining companies. It is common knowledge that most workers of several mining establishments in South Africa contracted lung diseases. 2 specialized occupational health clinics were set up in the country to provide health support services to these workers to return when they return back home. A task team has been set up to make these occupational health clinics in Manzini RFM and Hlatikulu Hospital to be self-sustaining. The team is already on the ground, working around the clock to have the suspended services at these centers restored, and also look into possibilities of providing broader occupational health services to all workers in the country. Worker and employer federations are encouraged to make use of the services that will be provided at the centers, as these centers will be specializing in treating workplace health issues. Government will, in collaboration with partners, continue to explore possibilities of extending occupational health specialized services to other strategic partners of the country, other strategic parts of the country. As I conclude, ladies and gentlemen, I wish to turn to the COVID-19 pandemic and the intense impact this disease has had on nearly every aspect of the world. The pandemic is a global challenge for safety and health at work. Workers, business owners, customers, and all other people in the world of work have been at risk of infection, and some workplaces have become sources of outbreaks of the virus. Informal workers and formal enterprises have been particularly vulnerable during the crisis to occupational safety and health risks, as they lack sufficient appropriate protections, pushing them further deeper into poverty traps. Formal work environments, just like the informal ones, have also been affected by COVID-19 in a way that no other virus has ever had in recent times. The consequential effect of the crisis is a befitting theme for these times. Post today's event, I want to challenge the tripartites, which is government, employers, and workers, to have a serious dialogue on the establishment of a resilient occupational safety and health system for the country. That is a system that will be comprehensive and adaptive to all types of work. Ladies and gentlemen, with those remarks, it is now my pleasure to declare the 2021 Safety and Health at Work Day Eswatini chapter officially launched. I thank you.